Today we are going to talk about veterinary surgical instruments, the tools used to cut tissue, control bleeding, expose structures, handle organs and place sutures while minimizing unnecessary trauma. Instruments may look similar, but their jaw pattern, tip shape, length and locking mechanism determine which tissues they can safely hold. Good surgical technique depends on selecting the smallest instrument that can perform the task without crushing, tearing or devascularizing tissue. Veterinary surgical packs commonly contain scalpels, operating scissors, tissue forceps, hemostats and needle holders, with additional instruments chosen for the species and procedure. A scalpel produces the cleanest controlled incision. A number 3 handle commonly accepts smaller blades such as numbers 10, 11 and 15. A number 10 blade has a broad curved cutting edge suited to long skin and facial incisions. The sharply pointed number 11 blade is used for controlled stab incisions, such as entering an abscess or beginning a vessel incision, but its point can penetrate deeper than intended. The smaller curved number 15 blade is useful around delicate or confined structures, including eyelids, digits and small masses. The blade should cut through skin rather than repeatedly sawing, because multiple passes increase tissue injury. Scissors divide and dissect tissue. Mayo scissors have thick, strong blades and are used for dense fascia, linea alba, fibrous capsules and heavy suture material. Curved Mayo scissors can assist with blunt dissection through tougher tissue planes, while straight Mayo scissors are commonly reserved for material outside the body. Metzenbaum scissors are longer and more delicate, making them better for spreading through loose connective tissue, separating subcutaneous tissue and dissecting around vessels, nerves or organs. They should not be used to cut wire, heavy fascia or thick suture because this dulls or damages their finer blades. Bandage and suture scissors are kept separate from tissue scissors to preserve the cutting edges used inside the patient. Thumb forceps are held like a pencil and provide counter-traction during cutting and suturing. Smooth or finely serrated forceps are used on delicate tissues such as bowel, bladder, vessels and reproductive organs because they distribute pressure without puncturing the tissue. Adson-Brown forceps contain multiple small intermeshing teeth that provide controlled purchase on skin and fascia with less pressure than repeatedly squeezing smooth forceps. Rat tooth forceps, commonly configured with one tooth opposing 2 teeth, securely grasp skin, tendon edges and dense fascia, but they can puncture intestine, bladder or friable organs and should not be applied to these tissues. Veterinary surgical training kits commonly include Adson-Brown and rat tooth tissue forceps because each serves a different tissue handling purpose. Hemostatic forceps, or hemostats, clamp blood vessels and tissue pedicles until they can be ligated, sealed or cauterized. Halsted mosquito forceps are small and delicate, making them appropriate for tiny subcutaneous vessels and small feline or pediatric pedicles. Kelly forceps have transverse serrations on only the distal portion of the jaws and are used for medium vessels or blunt dissection. Cryo forceps have transverse serrations along the full jaw length, creating a more uniform grip on vascular tissue. Rochester-Carmalt forceps are larger and stronger for thick pedicles or substantial tissue bundles. Rochester-Carmalt forceps are especially important in ovariohysterectomy and other procedures involving large vascular pedicles. Their longitudinal jaw grooves and cross serrations near the tip help compress structures such as the ovarian pedicle or uterine body while reducing sideways slippage. The instrument must match the tissue's size and firmness. A narrow clamp or thin ligature applied to a large, turgid uterus can act like a wire cutting through tissue, whereas a broader Carmalt distributes force over a larger area. Tissue forceps with locking handles are designed for retraction rather than vascular hemostasis. Allis forceps have inward projecting teeth and firmly hold dense fascia, skin edges, tumor capsules or tissue that will be removed. Because they crush and puncture tissue, they should not be applied to healthy intestine, bladder, ureter or blood vessels. Babcock forceps have broad, rounded, fenestrated jaws that spread pressure across a larger surface. They are preferred for gently holding bowel, fallopian or uterine tubes, ureters and other hollow structures when less traumatic traction is required. Allis and Babcock forceps may appear similar from a distance. but applying a toothed Allis to fragile bowel can create perforation or devascularization. Both are recognized core veterinary instruments, but they are intended for very different tissues. Doyen intestinal forceps are crushing clamps placed across bowel to temporarily prevent leakage of intestinal contents during resection or enterotomy. Their long, atraumatic jaws distribute pressure rather than sharply crushing the intestinal wall. Crushing clamps may be placed only on bowel segments scheduled for removal. Sponge forceps have oval fenestrated jaws and are used to hold gauze, prepare skin, absorb fluid, or gently manipulate tissue with a moistened sponge. Towel clamps secure surgical drapes to one another or to the patient's skin. They should not be mistaken for tissue-holding forceps because their sharp points can penetrate deeply. Needle holders grasp curved suture needles. Mayo needle holders are strong and commonly used for skin, linea alba, muscle, and routine abdominal closure. Olsen instruments combine a needle holder with built-in scissors, allowing one instrument to place and cut suture, although accidental cutting can occur if the scissors are closed at the wrong time. Fine needle holders are used for vascular, ophthalmic, and microsurgical needles. The needle is usually grasped near the junction of its middle and rear thirds, rather than at the point or swaged end, because crushing these regions weakens the needle or damages its attachment to the suture. Veterinary teaching programs commonly require Mayo or Olsen needle holders as fundamental surgical tools. Retractors maintain exposure so the surgeon does not pull continuously on tissue. Handheld retractors such as Army Navy, Sen and malleable retractors move skin, muscle, or abdominal organs while an assistant controls pressure. Self-retaining retractors remain open by themselves. Gelpi retractors have pointed outward curving tips and are useful through small incisions in muscle or the perineal region, but the tips must not penetrate nerves, vessels, or abdominal organs. Balfour retractors spread larger abdominal incisions and use a central bladder blade to retract the abdominal wall, or viscera. A spay hook is used through a small abdominal incision to locate and elevate a uterine horn during ovariohysterectomy. It should sweep gently along the internal abdominal wall rather than blindly hooking bowel, bladder, or spleen. Suction tips remove blood and lavage fluid, while electrosurgical instruments cut tissue or coagulate small vessels by delivering electrical energy. Electrosurgery can improve visualization by controlling hemorrhage, but excessive energy causes thermal injury beyond the visible contact point. Every instrument is an extension of the surgeon's hand. Delicate tissue requires fine instruments and minimal pressure, while dense fascia or large pedicles require stronger instruments with broader contact surfaces. Instruments must be cleaned, inspected, correctly assembled, sterilized, and kept sterile until use. Damaged serrations, loose hinges, misaligned jaws, or dull scissors increase tissue trauma and make hemostasis less reliable. Safe surgery therefore depends not simply on knowing an instrument's name, but on understanding exactly which tissue it is designed to cut, grasp, clamp, retract, or suture. If you would like to donate to our video and game development or suggest topics, reach out to dogtoursgame@gmail.com.